Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and today we're going to talk about Ebola update for October 15th, 2011. Some more new news is out there. Thomas Duncan, the first gentleman who came over from West Africa on an airplane, has died. We all know that. He was cared for in a Texas hospital. He had an entire 23-bed ICU dedicated just to him. They shut the ICU down to take care of him. Anywhere between 75 and 125 people were involved in his care, full hazmat suits, full protocol. We've now had two separate nurses who cared for him who have gotten sick. The first nurse was a couple of days ago. She's doing well, we're told, with Ebola symptoms. The second nurse was supposed to be home and on self-quarantine. She took an airplane to Ohio and back and then got sick and was confirmed as the second case of Ebola transmitted from a person in the United States. What's very interesting and a little bit disturbing is the CDC is still claiming that this is a very difficult infection to catch. They used words like breach of protocol, blaming the first nurse that she must have done something wrong in her care of the patient. That's why she got sick. They questioned the second nurse's protocol as well. They used words like complacent. And I will tell you that if I was caring for somebody who had a disease at a 50 to 80% chance of death, complacent would be not anything to do with how I would describe my care of the patient. What's also happened is that I went back and looked at the 1,700 cases between 1976 and today, or 2013. You can do the math, that's 46 cases a year over the last 37 years. We've had 8,400 cases just this year. It originally was in Central Africa, what they call the bush, and it's now in a more urbanized Western Africa and obviously surviving in the United States. The CDC is unwilling to say that this is possibly respiratory spread. There's at least one physician, Dr. Sanders out of Purdue, who's done Ebola research, says there's receptors in the lungs, and Ebola given to animals through the lungs creates Ebola infection in the animals. The virus is small enough it can be transmitted in respiratory droplets for at least for a short while. It does live outside of the body for a short while. It is reasonable to expect that if you cough or vomit Ebola and somebody breathes that in, that they can get the infection. So for right now, they're claiming no respiratory spread, only direct contact. They're still sticking to that you are only sick while you have a fever. So during this 2 to 21 day incubation period, you're allowed to roam around free and you're supposed to not be sick, and then only when you get sick with your fever should you go in quarantine. So this lady, the nurse who just got it, was quarantined within an hour and a half of getting sick. She was on an airplane, and I don't know that I can confirm, nor anybody else can confirm, that you're not contagious prior to developing symptoms. We'll look at chickenpox as an example, and you're contagious for 1 or 2 days before you actually show the rash of chickenpox. So you're walking around everybody you cough on for 2 days before your first pimple, you're actually spreading the infection too. So what may be possible with the Ebola virus is that the incubation period may be changing, the contagious period may be changing, the transmission mode may be changing, which is explaining why it went from 46 cases a year to 8,400 cases just in this year. It may also explain why seasoned physicians in Africa who have been caring for these patients for years never got sick, and now there's a handful of physicians who are experienced doctors who are getting the infection despite their precautions. Bloodborne infections, hepatitis, HIV, simple wearing of gloves should be adequate to care for these patients. Wear a mask if they're coughing. These people are scared to death taking care of these patients. They're paranoid. They are taking above and beyond extra precautions. They're covered from head to toe, and at least 2 now of anywhere from 75 to 125 people who have cared for this patient have gotten infected from what we think is current day 100% safe care. So I don't have the answer. No one does. I don't think the CDC has the answer, and I've said it before that politics is not the way to care for an epidemic. The original question was asked as to why we don't limit transfer or limit flights out of West Africa to the United States. And President Obama's answer was because it would be devastating to their economy. So an epidemiologist, someone trying to control an infection, should not be burdened by the economy of Liberia. They should be worried about people getting it across the planet because of airplane transport. So 2 people have gotten sick from 1 patient in the United States. Now there's going to have to be 75 to 150 patients potentially caring for these 2 patients. Do the math. You're going to have massive exposures. I don't think this was complacence as the issue. I don't think it was breach of protocol. I think the virus is much more contagious, at least at this point, than it has been for the knowledge of what we know about it for the last 37 years. Dr. Castello, thanks.